Hey, Dr. Karli here with the Karli Center. Let's talk about an interesting topic. Are your stem cells, if you're 50 or 60 or 70 years old, any good anymore? A lot of times patients come to me, they're 70, and they say, I want embryonic cells or placental cells or someone else's cells who's younger than me because they're better. And they read about this and they see it on the internet. Well, let's talk about the facts and what we know from science. There's no definitive proof that someone else's cells are better than yours for treating you. Now, a lot of work is going on to try to understand different cell types and how they work in different situations. But right now we know your cells won't hurt you. So there's a safety advantage that's obvious, and one of the reasons the Food and Drug Administration allows us to use your cells to treat you. That's important. But think about it for a second. Your cells and your DNA are perfectly coded to keep you healthy unless you have some type of genetic disorder. So someone else's cells are perfectly designed in their DNA to keep them happy, not you. So theoretically, it creates an issue of, well, is someone else's cells who are designed to keep them healthy going to work better than yours when yours are perfectly coded to keep you healthy? It's a confusing term, but one of the reasons we've focused on using your cells to treat you, if you're reasonably healthy, is that they're safe, but also we've found there's no evidence that using someone else's or using a younger cell is clearly better than using your own, as long as we can get enough of them, concentrate them, and apply them where they need to go. This is an important issue in the space and important for you to know as a patient consumer. There's not comparative data showing that someone else's cells or a younger cell is clearly better than yours yet. So we're going to stay with that model, but we're going to keep an eye on all these other evolving models to see what cells are going to win the race.